Good evening, and thank you for joining us tonight. We are very pleased to present an exciting and informative webinar about UltraShape this evening. Our special guest speaker tonight is Dr. Stacy Chimento. She graduated top of her class from the University of Miami Miller School of Medicine and completed her dermatology residency at Jackson Memorial Hospital, University of Miami Miller School of Medicine as chief resident. Dr. Chimento has completed numerous research studies with the Department of Dermatology and Cutaneous Surgery and was published in the Journal of the American Academy of Dermatology, Contact Dermatitis Society, and the Journal of Drugs and Dermatology. Dr. Chimento is board certified in dermatology and is highly trained in general medical, surgical, and cosmetic dermatology with an interest and expertise in acne treatment, rosacea, and hair disorders. Tonight, Dr. Chimento will be presenting her insights on introducing UltraShape into her practice. She will share why she chose UltraShape and discuss her considerations in addressing the body contouring demand for her patient base. She will also discuss her thoughts around other body contouring technologies and her experience in using UltraShape. If you have questions today during the presentation, we invite you to enter your questions into the Q&A panel. You can access this panel by clicking on the Q&A button in the upper right-hand corner of your WebEx Event Center window. We will be holding all questions until the end of the presentation. With that, I am very pleased to introduce Dr. Stacy Chimento.
Hi, everyone. Thank you so much. I first want to start off by thanking Cineron for this opportunity tonight. I'm truly excited to be here today to discuss with you a groundbreaking technology that I can personally say has really elevated our practice and truly has opened up a whole new set of doors for us. For those of you who do not know me, I am a dermatologist in private practice in Bay Harbor, Iowa, South Harbor, accompanied by my two other associates, Drs. Diane Walter and Bridget Nolan. Now, tonight is going to be a little different because you are getting a perspective from a practice that never really did any body contouring until UltraShape. And we have managed to successfully incorporate this technology into our practice model, and I'm so eager to share this experience with you tonight. Initially, we were very skeptical about purchasing any of these contouring devices because we were, kind of not too sure the efficacy of the devices on the market because, we tried them on ourselves and our family members, and B, how much revenue would this stuff actually bring to us. So we did our research, like I'm sure many of you are doing tonight, and we are so happy that we decided to incorporate the UltraShape. And even if you already have some sort of contouring technology, you will see by the end of this presentation that UltraShape can either complement and or improve the outcomes of your patient. So, I always like to start off with this because honestly, this is real life. This is what patients read and this is what we get in our office. This is what they follow. Society's perception of beauty and health has really changed over time. We live in an era that is obsessed with the idea of being skinny and fit. It's true. Everyone wants to look like J-Lo or Kim Kardashian. This is what we get in our office. People want to look like them. Why? Because, again, aesthetic treatments are culturally and media-driven, and beauty and fitness does indicate health and success. So based on this premise, and we knew that there was a high demand for non-invasive body treatments, it really was a no-brainer that we needed to offer some sort of non-invasive treatments for our patients. So I'm providing just a little bit of evidence behind what I'm saying in regards to high demand. We know that over the past 5 years or so, both nationally and in the United States alone, there's been anywhere from 13 to a little over 14% increase in the total sales in skin tightening and body shaping. This is just behind the #1 sellers, injectable fillers, and neurotoxins. Now, the recent data from the American Society of Aesthetics Plastic Surgery estimates that aesthetic patients represent a whopping $11 billion in revenue. And in the United States alone, the users are mostly women. These are going to be 91%. The majority are you're going to be your majority are menopausal or the post-baby, and 48% of the U.S. procedures actually come from women ages 40 to 54 years old. So why UltraShape in our practice? Well, really the main reason was that we knew that there was a high demand factor for non-invasive fat reduction, and then there was the need for customizable treatment. Patients were coming to our office inquiring about the latest, the greatest devices on the market. Many of these were the patients that did post-surgical procedures like liposuctions, or those that already had tried other cavitation devices. They really didn't see too much improvement, so they were seeking other alternatives. So then we knew that there was a need to differentiate ourselves from our competitors in an area as they were offering the more non-selective fat reduction cavitation devices. But even more importantly, we realized that by having a dedicated person that solely performs UltraShape would provide us with a great opportunity to educate our patients on the other various services, skincare procedures that he or she could potentially benefit from. It's really the truth. Having that right person in the back can really, it could really improve your practice. So we knew that honestly in the right hands, like I said, this provided tremendous cross-marketing opportunity for our practice. So I want to briefly just show this slide to make one key point. And really the bottom line is that invasive surgery is still the #1 treatment for fat reduction. But really when it comes to the body contouring device market, you can really see here that people are veering away from the more invasive procedures such as gastric bands, and they're really looking towards more non-surgical solutions like UltraShape, which if you look here, it's an approximate 100% increase over the 5 years, going from, again, 2011 to 2016. Overall, the market value in skin tightening and cellulite reduction is increasing as well. So who's going to be your target and who's going to be actually the ideal candidate for UltraShape? Well, we know that we live in a world where there are more than 1 billion overweight adults. The targeted population now is not going to be your really obese patients or going to be your really, really skinny patients, not your outliers. Be those subsets of patients that truly just are a little, frankly, they're overweight, or they have normal weight, just stubborn pockets of fat that they just can't seem to shed with traditional diet and exercise. So visually, it's truly going to be those with a BMI over 30 that are what I call going to be your non-melters. These are patients that will likely not get an optimal result and will be unhappy. But it's really the patients who are a little overweight, like I said, or normal, what I call skinny fat. They do all the dieting, you know, they do all the exercises, but they have those little pooches in the front. They have the dreaded love handles, I call the bat wings on the arms that us women we hate, the measles, the style bags. These are really going to be your patients that are ideal for what I call the muffin top meltdown. So now it's important, and I'm going to touch on this again later, on setting realistic expectations at your initial consultation, that truly this technology is not a weight loss program. It will never replace traditional liposuction, and we really make sure that we tell our patients that when they come in. It's not going to be ideal for those truly overweight patients, severe skin laxity, or they want cellulite removal. That's something different. So I always say if someone comes in and they says right off the bat they want a guaranteed 5 inches, you know, then you really need to think about whether that is truly a good option for that patient. So it's so crucial to be able to differentiate what we call visceral from subcutaneous fat when a patient comes in for initial consultation. And the real reason why is because the actual target for UltraShape is the stubborn subcutaneous fat. That's the one that is resistant to diet and exercise. Now, to the right of the slide, you can see that this is an actual scan of a man's torso that was taken before and after diet and exercise, showing you that, again, this is the entity that will shrink the visceral fat pad, but not the subcutaneous fat pad, which, again, would be our target in UltraShape. So now, what does everyone want to know? Really what you want to know is how does the darn thing work? You know, how does this thing really do what it says it does? So now UltraShape is the first and only FDA-cleared device that uses focused pulsed ultrasound to destroy these fragile fat cells non-thermally without harming the surrounding connective tissue, nerves, and muscles. And this is what makes it so unique and different from its competitors. It creates immediate and lasting results. There's really no downtime, no discomfort, and no side effects. Now, the suggested protocol, what we've been doing, is 3 treatments spaced every 2 weeks apart. Typically, they say it can take anywhere from 45 minutes to an hour to perform, but once the technician gets better and more efficient at the treatment, honestly, a 30-minute treatment can be executed perfectly. So really, it's a quick in-and-out procedure for your patient. So this is a great schematic. I love it. This is going to show you how the ultrasound gets from the handheld piece to the targeted fat cell. Well, what happens is that you have an alternating electric voltage that's applied to the electrodes in the transducer. This creates an alternating electric field within the ceramics, and the alternating electric field then creates alterations in the thickness of the ceramics, which creates a cone of focused, pulsed, high oscillating pressure waves. And these are selectively applied to the fragile fat cell membrane. And when that pressure is transferred inside, it basically creates almost like little holes or cavitations. And it keeps pulling that until the fat cell implodes on itself. The entire is truly mechanical. The temperature rises no more than 0.5 degrees Celsius, highly controlled to a depth of 1.5 centimeters. You know exactly where the energy is going. And because it's mechanical, there's no pain, and all the surrounding tissues remain intact and unharmed. So for those that like the science behind it, This is the low and high histological power photos of before and after the treatments with UltraShape. So you can see that the treated cells, again, that's going to be to the right. You can see that the treated cells are selectively destroyed immediately. But again, nowhere are blood vessels, nerves, or connective tissue disrupted. Again, this is really just reinforcing to you that the procedure has really minimal to no inflammatory effects, so that it's not painful and no side effects. By the time the patient gets to that second treatment, 2 weeks following treatment, as you can see at the bottom of the slide, there's nothing there. The patient's already in cavitation. They're ready for that second procedure. Now, initially, when the system first came out, it came up with one transducer, and this had about 8 grams of acoustic pressure, and there was only one focal depth allowable, and that was the 1.5 centimeters. However, Cinerod, being so good that they decided they wanted to enhance it even further. So what they did was in November of 2014, they enhanced the platform, and this consisted of what we call a VDF, or vertical dynamic focus transducer. And this has an increased power of 10 grams acoustic pressure and allows for even greater fat destruction because it allows you to treat these multiple layers of fat to decrease the overall thickness. They also introduced a much lighter, smaller version transducer that has a single focus depth of 1.5 that was designed to virtually treat any size or shape of small pockets of fat. So this then basically opened up a whole new set of customizable treatments for patients, and this is, again, to include hard-to-treat areas like submental fat, arm fat, and the upper back fat as well. Now, this is showing you in detail. I love this because really the new and improved treatment modes for the enhanced volumetric fat destruction, just really one single treatment. It's not easy. So now, rather than doing a single focus deep mode, which we originally came out with, is at a depth of 1.5 centimeters, and which is used to treat fat layers greater than 2.5 centimeters. You can now even treat even more superficial fat layers at 1.2 and 1.3 centimeters using a different mode called the double focus deep and medium mode. And these are going to be great. We use this a lot for fat layers that are greater than 3 centimeters and for treating large areas that have a lot of fat like the thigh. Now, if you want to get a really aggressive treatment, the best one, I call this the Mac Daddy treatment, really, this is the super mode double pass. And that's an option in which really the first pass delivers energy to a depth of 1.5 centimeters. And in the second pass, you will actually treat 1.2 and 1.3 centimeters of depth. So I like to make an analogy to a cake. You know, you have multiple layers in the cake. So each time you're performing an UltraShape treatment, you're basically evenly removing that layer of cake, condensing or compressing it like an accordion smoothly so you get no irregularities. Another analogy I like to put this to is kind of like a child that's in a ball pit, okay? They're at Chuck E. Cheese or something, and they're in the ball pit. And basically what happens is if you take out a few of those balls, what happens is that, again, the balls basically start crumbling and they spin regularly and smoothly. So really there's no irregularities. Now with the other cavitation device, just to give you a little idea, that's, you know, kind of equivalent, I like to say, you're at the beach. You take a shovel, you basically take a big scoop out of that sand there, and you're left with a hole. That's what the other cavitation devices are. So you always run the risk of having some irregularities, and you do not get that with UltraShape. So I really just want to show you visually the areas that you would use the larger transducer, the VDF, versus the U-Sculpt, which is a much smaller handpiece. Both have the acoustic pressure of 10 grams, but you can see small areas such as that arm fat we talked about, the inner thighs, even the knees. Those are the best areas that are treated with the U-Sculpt, the smaller ones. And the abdomen, the flanks, and the outer thighs are best treated with the larger handpiece. So this is showing you grossly what the enhancements of that 25% increased power and multi-depth destruction can do. On the left of the slide, you can see that's untreated porcine tissue as a control. In the middle, this will be a single treatment of non-focused ultrasound demonstrating immediate selective soft tissue destruction, only at 1.5 centimeters of depth. Look at the amount of destruction noted with the multi-depth approach all the way to the right using the super mode double pass. It's incredible. Again, looking here, all the layers, 1.2, 1.3, and 1.5 are treated, and again, that's in just one treatment. So now, this is another thing everyone wants to ask. How does the body actually eliminate the fat with UltraShape? Well, it's very simple. Fat is ultimately processed by the body's natural physiological and metabolic pathways that handle fat during weight loss. So honestly, it's just like if you were eating a cheeseburger, your body's going to digest it the same way. You get rid of that fat. The triglycerides from the broken fat cells are released into interstitial fluid. They're going to be metabolized by lipase into glycerol and free fatty acids. The glycerol gets phosphorylated and transported through the vascular system, and the 3 free fatty acids get bound to albumin and transported to the liver, easy, used as energy. So a lot of patients will ask right off, well, you know, I have a high cholesterol, is this going to elevate my cholesterol levels to the point of concern? And my answer is always absolutely not. It has been clinically demonstrated that the body's capacity to carry away triglyceride molecules supersedes and is much greater than the amount of triglycerides released through a single UltraShape treatment. So essentially, you know, there's virtually no limit on the number of areas that you could treat in one session. So the gradual clearance of the triglycerides occurs over the first week, and that's when you do see most of the circumferential reduction. And the clearance of the cellular debris will occur through the wound healing process, and that does take about 3 to 4 weeks. So why is UltraShape better than other cavitation or fat destruction devices? Well, honestly, just the biggest thing is that the results are seen so quickly, and that's what the patient wants. They don't want to wait 1 to 2 months. They want to see the results right away. So again, visible fat destruction will be seen in as little as 2 weeks post the first treatment. Patients are going to already start to notice improvement. It's effective. Clinical trials have shown an average of 2.5 to 6.3 centimeter circumferential reduction in just 3 easy treatments. It's easy and quick to do. Again, you're not restricted by the size of the handpiece, and you can do multiple areas with the same transducer. You can have the patients in and out of the office in less than an hour, well tolerated. There's really no pain, no discomfort, no need for pre-treatment with anesthesia. It's a very, very comfortable procedure for your patient. Now, showing you this is all I want you to get from this, is just showing the comparison of UltraShape to other non-focused ultrasound devices on the market. And we do this in a term that we call mechanical index. The mechanical index is just a way of estimating the degree of the bioeffects that a given set of ultrasound parameters will induce. So bottom line is that a higher mechanical index, which UltraShape does have, just means that it has a higher pressure, is more effective at inducing mechanical destruction or cavitation than the other non-focused ultrasound devices on the market. So now we're going to get to the nitty-gritty stuff. So this is going to be your comparison of UltraShape to the other big cavitation devices on the market. Now, CoolSculpting by Velashape has been around for a while now. It uses what we call the freeze-thaw necrosis mechanism of cryolipolysis with gradual fat cell destruction that occurs over periods of a few months. On the other hand, we got liposonics here, which again is thermal, so it kills fat through thermal necrosis. While pretty much all of the devices can treat the abdomen and flanks, this is true. Now, UltraShape can be used for the hard-to-treat areas in small pockets of fat, like we said before, the knee fat, the bra bulge, the inner thigh, and even the fibrotic areas can be treated, which the other ones cannot. Now, the beauty of UltraShape that is truly fully customizable to the body shape and habitus of your patient. There's no need for these applicators that can be uncomfortable and that can regulate. So you're not going to get any of that. Patients comfortable treatments with UltraShape, but do tend to experience discomfort at some degree while doing the cryolipolysis and the liposonic. So we chose UltraShape for our practice over the competitors because honestly, we wanted something that was first and foremost clinically effective. I mean, we wanted something that our patients were going to ramp out and that they were going to have great results. Secondly, we did not want a device that has potentially unfavorable side effects. The post-treatment course is so predictable with UltraShape. You know that there's not going to be any inflammation after the treatment, so the patient will leave the office very comfortable and no downtime. And although it's really hard to believe, they do leave looking and feeling like they did when they walked into the office, just a little bit skinnier. Time to visible results is literally as early as post-2 treatments after the first treatment, with additional reduction up to 6 months post-treatment. So patients are going to continue to get great results. And the most important factor of them all is that it works. Patients can expect to lose anywhere from 1 to 1.5 inches up to 4 inches in the recommended 3-treatment protocol spaced 2 weeks apart. Now, while the other top technologies available, such as CoolSculpting or liposonics, there's tremendous amounts of inflammation that can potentially lead to bruising, swelling, soreness, shelving, or even uneven fat production. Very rarely there is something called paradoxical adipose hyperplasia, and that has been reported in case studies in patients that have used cryolipolysis. And basically all that means is that they had the cryolipolysis done, and instead of actually getting fat reduction, the fat cells themselves have actually grown larger. And patients still have to wait 2 to 3 months for both of these technologies to see results. And honestly, despite the claims for single sessions, experience has shown that truly multiple sessions are needed to attain results, which are still not as superior as those seen in UltraShape. Now, I do want to point out just something because I have been getting this question. People have been asking me this a lot lately, and that's the new Cynosure Sculpture. This is going to be another device to be looking for coming up in the next few months on the market. It's a 1060 nanometer diode laser that has epidermal cooling. The big and a key difference for UltraShape to this new laser technology is that it's not selective. It still has thermal damage to the tissue. So you're still going to see, again, patients may have some dysesthesia, they may still have some numbness. It can be quite painful. And although there's a claim for one treatment, this is still to be determined. And secondly, UltraShape by comparison is still more clinically effective in centimeters lost to date. So that's very important to know. So here are some visual examples of the mentioned potential complications of cold sculpting with liposonics. We know that both can be very quite uncomfortable, and given the mechanism of non-systemic selective fat destruction, there's still a greater potential for bruising, swelling, and shelving. Having UltraShape truly, honestly, it gives you the peace of mind that your patients will be very comfortable and have an enjoyable body contouring experience. So now this is just showing you histologically the difference between the devices on the market and what we call the tissue response. So as you can see with UltraShape at the top, you can see immediately, you can see a mechanical effect. You're going to see your cavitations. And then 2 weeks post the first treatment, there are really no inflammatory cells. And even after 4 weeks post-treatment, there's no inflammation. The patient is completely fine. So looking at liposonics with the high flu thermal necrosis, again, grossly, you can see there's a lot of inflammation 2 weeks. And at 4 weeks, there's still tremendous amount of inflammation. Again, looking at cold sculpting, this is again, the Zeltique published data. Even 1 hour after cold sculpting, there's tremendous amount of inflammation. And at 4 weeks, again, still a lot of inflammation noted, hence why there's a lot of side effects with this technology. And so this is going to be the beauty herself. This is the UltraShape system. There's a sleek design. It's got an easy tracking guidance camera. It has a monitor, a focused ultrasound transducer. It's definitely foolproof. Now, what we really love about this machine is that it's fully customizable. It's customizable for the treatment for the size, the shape, and the area of each of our patients, and it is 100% delegatable. The user interface has a foolproof 3D real-time tracking guidance system. It does guide the operator through the treatment. It has pre-programmed treatment algorithms, very easy to use. It's great because it really ensures that the user is treating only the zone that you mark within that treatment area. Each point is only going to be treated once for complete and uniform coverage, and this provides no risk for contour irregularities, and that's the important. So I wanted to give you a video about how this really looks, okay? And essentially what you do is in the targeted area, the fat is gathered and strapped and are taped. And in fact, even in thin people, you will be so surprised at the amount of fat you can actually pinch. We all are models, you can treat it. Now with the tracking camera, a photo of the area is taken and displayed on the screen. And then the operator can actually customize or then draw out the areas that he or she wants to treat. So you can see here at this patient after the second treatment, again, this is, the third treatment at the bottom, they really could no longer concentrate the fat at the lower abdomen. There just wasn't much there to even treat. So what they were able to do is draw out periumbilically and treat the upper abdomen only. So again, it's customizable. You can actually do this to each of your patients. So I just want to make only one clinical study because honestly, tonight is all about just showing you the before and afters and giving you the information that you need to see if this actually is a technology worthwhile in your practice. This is a study by Dr. Chang, and the reason why, he figured out a way to further enhance the results of UltraShape. He actually preheated the subcutaneous fat with radio frequency with Velashape 3. And when we first started doing our treatments with UltraShape alone, like I said, we had never done any body contouring. We realized that, at that point, there was truly no one-size-fits-all device. We were removing the fat, but then we realized, okay, well, now we have some loose sagging skin, so what are we going to do? And now our patients were happy with the results, and then they wanted to do more body contouring. They wanted to start tightening and tuning. So we realized that we need to be able to offer to our patients a non-surgical skin tightening solution as well, and we had decided to incorporate the Vela 3, and have done exactly, which is with the preheating with the radio frequency, with the UltraShape. So now in this study, Dr. Chang took 32 subjects. They each received the 3 UltraShape treatments spaced 2 weeks apart with the Vela RF preheating prior to the treatment. And what he found was that actually combining that treatment gave an average abdominal circumference reduction of 3.9 centimeters plus 1.8 centimeters. And you can actually look here at the MRI studies. You can appreciate the significant reduction in the subcutaneous fat. So by preheating with radiofrequency, you actually create what we call a wet environment. And the wet environment is where the fat cells are becoming already metabolically active, so there's more circulation, more blood flow, the lymphatics are increased, and that further enhances the effects of the ultrasound cavitation. So here you can visually appreciate the significant reduction that these patients have had after 3 treatments of the combined approach of UltraShape and Velashape 3. Both the upper and lower abdomen in both of these patients had significant circumferential reduction, and again, that was in Dr. Chang's study. So now we're going to get to the meat of it all. So now again, I'm going to show you all the results. So here in the photo, this is courtesy of Cineron. This is a patient that was treated with 3 sessions of UltraShape, spaced 2 weeks apart, and there you can see 4 weeks post-treatment that the patient experienced 5 centimeter circumferential reduction in the upper and lower abdomen. And you definitely can see just so much improvement. And I want you to pay attention when we look at these photos at the back of the patient. Look at the contour. Just by treating the front of the patient, it actually does improve the back, the love handles, and again, I call that with the brassiere fat, that little pocket that sticks out that us women hate. It really does improve the contour. So here's a patient that's 4 weeks after her last UltraShape treatment to the upper and lower abdomen. She had experienced a huge, 4.7 centimeter reduction in the upper abdomen and 5.4 centimeters in the lower abdomen. This is a gentleman that's 2 months status post 3 treatments to the love handles, and this man actually lost 14 centimeters in total fat reduction. Unbelievable. And again, looking how the contour, you can customize this to your patients. That's two months post-treatment. So now even the dreaded saddlebags, we say, okay, the dreaded saddlebags can be treated. And all of us women can relate to that. There's finally a solution. So here's a middle-aged woman, pre-treatment and post 3 treatments of UltraShape to the lateral side, and she experienced 5 centimeter circumferential reduction loss. Incredible. Now UltraShape can also be an option for those patients even with gynecomastia that are seeking safe non-surgical options, and we have been offering this in our office as well. Now just to tell you a little bit about how we incorporate UltraShape into our practice. To date, we have done more than 750 treatments since October of 2014 on the abdomen, the flanks, upper back, inner and outer thighs, and the inner and upper knees in approximately 30% of men and 70% of women. On average, our patients have lost about 1.5 inches circumferential reduction after completion of the 3 treatments, with a range of about 0.75 inches to 4.5 inches, which is significant. And given the great results the patients have had, 35 of our patients have extended their treatments and 65 went on to treat other areas. So more importantly to us, it's a high patient satisfaction rate. So people continue to ask us, well, how did you guys do it? You never did that before. Did you advertise in magazines? Did you do something on TV, on the billboards? And the answer is absolutely not. We didn't do any of that. We literally put out an 8x10 cardboard advertisement in each of our patient rooms and a silent display. We have this little rolling digital photo. I cannot tell you, if not almost every patient inquires about the technology. When something works, patients, they talk amongst themselves. So they're happy with their treatment, they tell their friends, and their friends tell their friends, and that is truly how we were able to successfully incorporate UltraShape into our practice. It's all word of mouth. Patients are getting great results comfortably, quickly, with no downtime. So here's going to show you just a few of our photos to wrap up so you can see what we've had. This is a 55-year-old female in our office. She status post 3 treatments to the flanks and the abdominal bulge. She lost, again, 2.5 inches. And again, I want you to concentrate on the upper portion of the patient's back. To me, as a woman, this is one of those areas we really do not like, the back, the contour of it. And it's very impressive, again, like I said, how just changing one part of the body can create a difference in your shape. So this, again, is looking at her side profile, and you can, again, see how much smoother and contour the upper back appears as well. But, again, look at her abdomen, upper and lower abdomen, again, 2.5 inches in this patient. So this is another one of our patients. She lost 2.5 inches just after 3 treatments of UltraShape, and she was so thrilled with her results that she has gone on to treat other areas. And we mark out the area, again, look periumbilically, how much smoother that her stomach looks. And again, looking at the side profile. So you can see how much improved the upper and lower abdomen. Again, that's only right after her 3 treatments, 2.5 inches after 6 treatments. Again, please appreciate the upper portion of the back, how much smoother it is, and we never touch that area. Now, this is my favorite. This is a gentleman, I actually showed you him in a few slides ago. He was so excited about his results. He did go on Channel 7 in our local news and did talk about UltraShape because he really dropped so many inches. He's 75 years old, and you would think, 75-year-old Jimmy may not be a candidate, and honestly, when he walked into the office, I thought he looked more visceral than anything, but we were able to pinch some fat. We set realistic expectations with him, but he wanted to do the UltraShape, so we gave it a go. Now, he started those 6 treatments here to the abdominal bulge alone, and he lost 2.5 inches just from that. He was so pleased with the results, he wanted to treat further, even more his abdomen to get a 4.5-inch reduction, and he's never dieted or exercised a day in his life. Again, this is him after 9 treatments, 4.5 inches. He's definitely dropped down a few pant size. He is so thrilled with his results, and he honestly has brought a lot of patients to the office because he was just so thrilled and happy with the results that he had. Now, this is a 70-year-old female, status post just 1 treatment after her, just 1 month after her 3 treatments, of the upper and lower abdomen, and she reached 1.45 inches. And again, I want you to appreciate the upper and lower abdomen had significant improvement, and again, even better is looking at the side view. You can see that upper abdominal bulge, that's appreciable in the left upper quadrant. Again, so much improved, and she was so happy with her results. To finish, I wanted to share a few before and after shots of patients that we have incorporated the Velashape in their UltraShape treatment. So you can kind of see how the 2 technologies actually enhance the outcome. Now, this patient of ours has finished her series, and she was so funny. We took her, and she goes, I really don't know if I really got any improvement. And this is why I would say it's so important to have a wonderful, dedicated photography room. You've really got to be sticklers for weighing patients, taking measurements, that kind of stuff, which we really are. And so we showed her this before and after photo, and she goes, well, I think you're showing me the wrong photo. I don't know who that is. And we told her, Mrs. Smith or Mrs. So-and-so, this is you. And she could not believe how much tighter and smoother her abdomen was, and again, a testimony to the effectiveness of the technology. She lost inches, and her stomach looked almost like 10 to 20 years younger. She was so happy with her treatment. She is actually one of ours that has gone on to do more treatment. So this is a photo that's courtesy of Cineron, and really I love this photo, and I end with this because, when I saw this photo, I really didn't think it was real. I mean, this looked like a lady that just had a surgical procedure done. But I want to show you how astonishing this is. This lady has started those 6 treatments of UltraShape and Velashape on her abdomen, flanks, and thighs. And honestly, if this is not just a testimony to show you how much this machine works, I don't know what else does. So, I want to just really finish off by telling you that, UltraShape is such a safe and effective technology. It truly is such a quick procedure. It's immediate results. It's long-lasting. It's permanent. There's no need for maintenance with this, and there's such a high patient satisfaction rate. More important, it truly has provided a tremendous amount of opportunity for in-house marketing for us and growth of our practice. We've been so blessed to have our technician in the back. She's wonderful. She has really, truly grown my practice. And like I said, we're so thrilled to incorporate UltraShape into our practice. I hope that this information was very helpful for you tonight if you're considering a body contouring device. And if at all, honestly, if you think of a question later on or you need any additional information regarding this technology, please feel free to contact me personally. Thank you so much for your attention, and a big thank you to Cineron again for having me tonight.
Great. Thank you so much, Dr. Chimento. So we do have a couple of questions for you. So the first question for tonight is, what do you charge for treatments?
Okay. So naturally, I will tell you, the way that it works is that there is a consumable. And what we do is there's something called focal treatment zones. So a focal treatment zone is basically, that's going to be your consumable. And it's about $25 per focal treatment zone. A normal abdomen is about 8 to 10 FTZs, we call it. Okay, so if you think about $25 per FTZ, it's about 8 to 10. It comes out to be $250 per consumable. So this is important. You know, I did not mention that in there, but now I'm going to get to the financial part of it. So your cost is about $250. Nationally, typically just for a regular abdomen, okay, you can charge up to about $3,000, okay? That's for the 3 treatments combined. That's what the going rate is. In certain areas, you can go up as high as about $3,600 to $3,900, which seems like a lot. But honestly, I will tell you, when patients come in, they want non-surgical results, and you tell them the price, and they really don't blink an eye. So I would say on an average, $3,000 is typically what the charging rate is.
Okay. Our next question, what other treatments do you bundle with UltraShape?
Okay. So what we have done, so like I said, we're new to body contouring. So the first thing that we really have been doing is bundling the Velashape with the UltraShape, again, for that maximal result. And the way that we typically have been doing is that we've been preheating this, preheating the abdomen or the area, for that matter, for about 10 to 15 minutes with the Velashape. Then we perform the UltraShape procedure, okay? We typically have the patient come back the following week. They will come for just a plain old Velashape. The following week, they'll come back. They'll get a pre-RF with the Velashape. They'll get an UltraShape treatment. And again, we kind of keep going like that, back and forth, until they basically finish everything. That's typically what we have been bundling with that before. Again, there's a lot of outside things that you can do with UltraShape, and again, I'm very happy to discuss that with you privately via email, that kind of stuff. But for right now, we've just been bundling it with the Velashape for the moment.
Okay, great. You talked a little bit about the technician that you have operating the system. What are the criteria for how you selected that person, and how long did it take that individual to get fast at the treatments? Okay,
that's a very good question. We actually found our technician. She was literally, we call her our angel. She's fantastic. But we actually found her through our local Cimarron Candela rep, and he had recommended her to us. She is a laser technician, and also she's an esthetician. So she had a little bit of background. But again, this technology is such an easy thing to do. Once you have that training with Cimarron, honestly, anyone could do it. I even think that a young child can do it. It's pre-programmed algorithms, et cetera. I have to say a testament to Ruth. That's who our technician is. She's very, very good at what she does. It did not take her very long at all to basically get to where she is now. And the beauty of this, I think this is very important to tell, practice owners and the physicians, is that if you start, if you're worried about the technician performing the treatments in the back and you're not getting results, that kind of stuff, the system is so intuitive. It basically will document everything that technician does. So if you start noticing, or you think that patients aren't getting the results that they should be, you can actually go into the system and pull up your technicians, what we call the error rate, to see if they're actually hitting those targets or not. So that's another thing that I think is very beautiful about this system, is that everyone should be getting some improvement with it. So, Ruth's fantastic. She's, I think, one of the best in the country. She has a less than 4% error rate. So, that's the most important thing that you want to look for your technician. And it's easy. They can learn it quickly.
All right. Going back to the bundling question regarding UltraShape and Velashape, the question is, when you bundle UltraShape with Velashape 3, how much extra do you charge?
Sure. So what we have actually been doing is we charge them about $900 additional. So say, for instance, the average abdomen is about $3,600. That's for their 3 treatments of UltraShape. Then we will tack on, and we do give them a discount. So they will tack on the Velashape for $900, okay? And that's typically how we bundle it. And that's they'll still get their pre-treatment RF with their UltraShape, and then every other week, every week they're coming in for some sort of treatment, whether it's the UltraShape and Vela or just the Velashape themselves.
Okay, our next question is back to marketing. You mentioned earlier that you do a lot of word of mouth and you have the cards in the rooms. This question is, do you do any social media?
So our social media, honestly, we have Facebook accounts, we have a Twitter account, that kind of stuff. Our social media, honestly, every now and then we will post something courtesy of Cimarron, whether they give us like I showed that little muffin top or something really cute, we will put up on our social media. But I honestly, in my opinion, I really don't think that our patients are getting it mostly from social media. I do think it's an adjunctive. I think in this day and age, you do need to do that. But really, it's from word of mouth, and it's from having that rolling picture, having all these pictures in the room. Patients are sitting there for about 5 to 10 minutes in the room, so it gives them something to look at, and they're really intrigued about that. So that's pretty, like I said, it's the only marketing we've been doing.
So on that note, the next question is, do you have a dedicated room for your UltraShape, and how many UltraShape patients do you see every day?
Okay, so that's a good question too. We do. We have a dedicated UltraShape room because, like I said, we do a lot of these procedures in the office. So we built one little small room. Okay, it's not a huge room, but it's a very nice, comfortable room. We have our Velashape and our UltraShape in there, and that's where Ruth, our technician, does all of our treatment. And I will say, Ruth she's booked. I mean, every single day she's booked. So she will have anywhere from about 3 to 4 UltraShapes a day, and that's not including the Velashape that she does, whether it's just solely alone or in the combination. So I would say, about 3 to 4 a day, and then some days she can have even up to 5.
Okay, and the next question is actually about the treatment. Are you using mostly single focus mode or double medium, double deep, or super pass mode? And how do you advise your technician to choose between the modes?
Okay, the technician has been trained in all of the modes. So again, like we were talking about, the single focus mode, again, if it's a fat that's greater than 2.5 centimeters and there is a caliber and you do measure that fat. We talked about the double medium mode. Again, that could be 1.2 and 1.3 fat layers greater than 3 centimeters. And then the super mode, which again is going to be 1.5, 1.2, and 1.3. If you have a patient that is honestly just, they're thin, okay, or when I say thin, they have like a little pooch or a little pocket of fat, that's the kind of patient that, again, you might just want to do the 1.5 centimeter on. The patients that, again, they have a lot of fat in the area and you really want to get the best destruction, then you would do the super pass mode. Ruth is actually, our technician really decides based on, like I said, the caliber and the measuring the fat layer. That's how she will decide on what she's going to do. I do think she does a lot of super mode because, again, we think that that's going to be the best fat destruction. But for the most part, again, to answer your question, it really depends on the fat layer of the patient.
Okay, great. Thank you. The next question is, what post-treatment follow-up do you do with your patients, if any? Do you do any kind of exercise or diet regimens?
Okay, so the beauty of UltraShape, again, is that really an exercise is not, you don't have it. Fat it's a permanent destruction. However, and I say this however, slide I showed you, that visceral fat is subjective, so the visceral fat, if you eat and you continue eating, that visceral fat is going to get larger. So we counsel our patients and we do explain to them that, if they did diet and exercise, they will shrink that visceral fat. So UltraShape's taking care of that subcutaneous fat. If they diet and exercise, they're going to shrink their visceral fat, so they're going to get an even better response. So yes, we do counsel them and advise them, and we explain to them the science behind it, and they get it. And that does motivate them because they see that they're getting the results, and they say, oh my God, well, if I diet and exercise, I'm going to get a better result, so they do that. We encourage a lot of water intake for the first 48 hours. We do encourage them, again, to start moving around to kind of get that lymphatics and get the fat cleared from the system.
Okay, great. Thank you very much. That is all the time we have for questions today. I would like to extend a very special thank you again to you, Dr. Chimento, for sharing your experience with us today. Are there any parting thoughts that you can share with us?
Sure. Like I said before, I think we truly made the best decision incorporating UltraShape into our practice. It's an easy technology. It's been extensively studied, which I think is very important in anyone considering a fat cavitation device. You really have to look at the studies. It works. Patients get great results. There's no discomfort whatsoever. And really, like I said, with the right technician in the back, it's just such a wonderful opportunity for cross-marketing and upselling. And we're really, truly happy that we did incorporate this technology. And I do want to thank you again for having me here tonight. I truly appreciate it.
Great. Thank you so much. And thank you all for joining us today. And we invite you to speak with your local rep for more information on any additional questions that you may have. Thanks again, and we hope you have a wonderful evening.
Thank you.